Hello everyone and welcome in this session of Dermatology with me, Dr. Chesta Agrawal, your NEET PG educator on the best platform that is Unacademy. Now, before we start, it's a very important notice that Unacademy is launching a MedMine Ultra Combat, which is scheduled for 16th of this month, that is 16th of October. I request all my students to kindly get yourself enrolled. Now, there are few features about this test which everybody need to know. Please remember, in this particular test, we will be giving you separate paper for all the years. If it is MBBS Part 1, Part 2, 3, 4 and intern, post-intern. You will get a separate rank for each year as well. The winners or the toppers will have an amazing prizes. The reward worth rupees 10 crores are there. We have laptops, iPhones, iPads. In addition to that, even the Unacademy subscription or scholarship of up to 100% is provided in this particular subscription. I request all my students to kindly enroll. For enrollment, you need to put a code and the code is Chesta10. You can use my code CHESTA10 and get yourself enrolled in this particular test. It's a free test. You can just use this code and get yourself enrolled. Now, we are also celebrating the important like the offer for the student right now. So anybody who is interested in buying the Unacademy subscription, today is the last day to avail the 20% discount offer. Please use my code Chesta10. When you select the duration of the course, you will get an option of putting a user or an educator code. Kindly put the code Chesta10 here to get 20% discount on all the Unacademy subscription. Longer the subscription, better will be the offers for everyone. We are also having a NEET PG All Educator Ultimate Revision Batch, which is starting on 14th of October, that is today. I request all of you to please be a part. It's a 5-month course and you will be taught all the important subjects with respect to the exam point of view in this batches. The question bank 2.0 is already out, so anybody interested can go for Unacademy Lite subscription. Don't forget to use my code, that is Chesta10, CHESTA10. Now let us start with the questions in the today's session. I hope everyone is ready with the questions. Are you all ready? Can you give me a quick thumbs up? Now let me start with the questions. Just a second, I'm very sorry for this. Yes, the first question is here. Which is not due to decrease in the number of melanocytes? Which is not due to decrease in the number of melanocytes? These are all MCQs, the previously asked questions, which is must know for all the students. Which is not due to decrease in the number of melanocytes? Vitiligo, piebaldism, Waardenburg syndrome or albinism? Anyone can tell me the correct answer? Okay. Now please remember, the pigmentary disorders, we have divided pigmentary disorders into two basic groups. We have divided pigmentary disorders in hypopigmentary and in hyperpigmentary disorders. The hypopigmentary disorders, it occurs, the decrease in the pigmentation which is seen in the patients of hypopigmentary disorders can be because of decrease in the melanocyte count, or it occurs because of normal melanocyte count but decrease in the synthesis of the melanin. So the melanocyte count is normal. The melanocyte count is normal, but the synthesis is reduced. The melanin production is reduced. The melanin production is reduced. What are the examples in each of them? Please remember, the melanocyte count reduced. It is seen in conditions. There are some congenital conditions, some acquired. Congenital conditions like piebaldism and Waardenburg syndrome. Piebaldism and Waardenburg syndrome are the congenital conditions with reduced melanocyte count. The acquired condition is vitiligo. What are the conditions where the melanocyte count is normal but the melanin production is reduced? Please remember, these are oculocutaneous albinism. Second, we have Chidak-Higashi syndrome. Then we have Griscelli syndrome. In all these conditions, the amount of the color is produced less, and that is the reason for development of the hypopigmentary disorder. So these are the list. Now going back to the questions. The question is, which of the following is due to decrease in the number of melanocyte? Vitiligo is because of decrease in the number of melanocyte. Piebaldism is because of decrease and Waardenburg is because of decrease. But albinism is not because of decrease in the number of melanocytes. It is because of reduced production. The problem in the albinism patient is the tyrosinase enzyme which is required for production of melanin, it is not produced. ठीक है, it is either not produced or it is lesser in number or it is not functioning properly. So that is the reason for development of hyperpigmented lesions in the patients of vitiligo. Clear all of you? Now next, moving to the question here. The typical site of affection in a riboflavin deficiency is, typical site of affection in the patients of riboflavin deficiency is sun exposed area, friction sites, seborrheic areas or flexural sites. Typical site of affection in riboflavin deficiency are, anyone? Very nice. Now what is riboflavin? Riboflavin is vitamin B2. Vitamin B2 deficiency, the most common cutaneous lesion which you get is, you have angular cheilitis, chapped lips, and you can even get glossitis. In addition to that, you develop seborrheic dermatitis like features. So which type of skin affection you see in vitamin B12 deficiency? This is vitamin B12 deficiency. It is the seborrheic dermatitis like picture. Seborrheic dermatitis like picture. Similar to this, please remember in the patient with vitamin B3 deficiency, which is niacin. Vitamin B3 deficiency, which is niacin, the main site of affection is what? It is the sun exposed. So you see sun exposed areas more involved, sun exposed areas. Like that in the patients of acrodermatitis entropathica, in the patients of acrodermatitis entropathica, acrodermatitis enteropathica, acrodermatitis entropathica, which is a congenital zinc deficiency, the patient have periorificial type of dermatitis. So these are the important point which you all need to remember for all these conditions. Clear all of you? So typical site for riboflavin is seborrheic dermatitis, but B3 it is niacin, or niacin deficiency it is the sun exposed areas, and congenital zinc deficiency it is orificial dermatitis. Okay, now let's move to the next question. The corkscrew hair with periorificial purpura are features resulting from deficiency of what? Vitamin A, vitamin D, vitamin E or vitamin C? What is the correct answer? The corkscrew hair with periorificial purpura are features resulting from the deficiency of, anyone? Very nice. Please remember the corkscrew hair, which is also known as swan neck deformity, or it is sometimes also known as pigtail hair deformity. Now what happened to the hair? The hair becomes something like this, and this along with periorificial purpura, it's a very classical feature of vitamin C deficiency or scurvy. Very classical feature of vitamin C deficiency or scurvy. Clear everyone? I think it's an easy one. Moving to the next question. A 50-year-old male chronic alcoholic presented with pruritic, sharply demarcated erythematous rash over the anterior aspect of the chest and the forearm. The most likely vitamin deficiency implicated in this patient is, the most likely vitamin deficiency implicated in this patient is niacin, riboflavin, vitamin and biotin. So actually there should be something here, vitamin, just write vitamin C here to be more specific. Can you tell me the answer, anyone? Great. The correct answer of this question is niacin. A chronic alcoholic, please remember vitamin B3 or niacin deficiency is very common in alcoholic. The reason is they are not taking proper food, and because of the improper food or non-balanced diet, they tend to develop the deficiency of niacin. You also see similar deficiencies in the patients who are taking jawar and maize as their staple diet. In both these crops, the amount of tryptophan is very less, and there is very less absorption because of presence of isoleucine, and both these features will cause reduced production of niacin. Another is when you have these syndromes like carcinoid syndrome, because the tryptophan is being diverted in synthesis of serotonin. In some malabsorption syndrome, again the tryptophan is not being absorbed and the patient presents with deficiencies. What do you develop? You develop sharply demarcated rash, which is the photo-exposed lesions. We have discussed just now that in the patients of vitamin B3 deficiency, the lesion occurs on the sun-exposed areas. In addition to these patients have diarrhea, and they will also have dementia. So we have 3 Ds: dermatitis, diarrhea, dementia, and if we do not keep a check on this, they can even die. So the death is also one of the D if the patient do not receive a proper treatment on time. Next question. Hair changes such as alopecia, decreased hair pigmentation can be seen with which of the following nutritional deficiency? Which of the following nutritional deficiency presents with hair loss or decreased pigmentation? Scurvy, kwashiorkor, beriberi, or marasmus? Anyone can tell me the answer? Very important. They are all PYQs. I request all my students to kindly remember these questions. Hair changes such as alopecia, decreased hair pigmentation can be seen with which of the following nutritional deficiencies? Amazing, great, very nice. The correct answer of this question is option number 2. Please remember, in kwashiorkor, patient develop a very classical flax sign. What is flax sign? It is alternate dark and light bands which are present on the scalp hair, and this give you an idea that what are the times when the patient had protein energy malnutrition. You also develop the cutaneous lesion in the form of flaky paint dermatosis or parchment type of skin. The skin keep on exfoliating, so parchment type of skin or flaky paint type of dermatosis. Moving to the next question, which of the following is the common micronutrient deficiency found in the patients with eating disorders? Vitamin C, zinc, vitamin A, or vitamin B12? Which is the common micronutrient deficiency which you see in the patients of eating disorders? The common micronutrient deficiency seen in the patients of eating disorder. I request each and every one of you to please participate in the recent upcoming scholarship test. If you remember, I told you just now, you can use my code Chesta10 and participate in this free MedMind scholarship test. Plus, if you use this code, you will get 20% discount on Unacademy subscription. The offer is only valid till today, so please don't forget to use this code. Okay. The correct answer, very nice. So please remember, it is the zinc deficiency, which is the most common micronutrient deficiency which is seen in the patients of eating disorder. Very common is the very common nutrient deficiency which you see in these patients is zinc deficiency. Now let's move to the next question. I think it is visible now. A 5-year-old male had multiple hypopigmented macule on the trunk. On rubbing the lesion with the rounded end of the pen, patient develops urticaria wheal confined to the border of the lesion. What is the most likely diagnosis? What is or which is the most likely diagnosis here? Anybody can tell me the answer? This is a patient with a very characteristic Derrier sign positivity. Now if you look at this question, the question says that on rubbing the lesion with the round pen, he develops wheals or urticaria. This is what is known as Derrier sign, and I think now you all know that it's a feature of urticaria pigmentosa. What is urticaria pigmentosa? Urticaria pigmentosa, it's a disease where there is accumulation of mast cell in the skin or the systemic organs. It occurs because of mutation in c-KIT gene. Now in the children, we mainly see the accumulation of mast cell in the skin, and that is why urticaria pigmentosa, it's a form of cutaneous mastocytosis. Patient usually present with hyperpigmented lesions on the body, something like this. Can you see the lesions? Yes, so these lesions are hyperpigmented flat lesions, but as soon as you scratch them, can you look at this image? As soon as you scratch them, you develop, or the patient develops wheal or urticaria like lesions over them. This is a feature, or this is a sign which is known as Derrier sign. In addition to that of the urticaria pigmentosa, it is positive in 3 more conditions. There is something known as pseudo-Derrier sign which is positive in the patient of smooth muscle hamartoma. It is positive in the patients of smooth muscle hamartoma. Okay. So with this, we are done with the today's session. I hope everybody have enjoyed. But before winding up the today's session, I request all my dear students to please get yourself enrolled in the MedMind Ultra Combat Gamified Scholarship Test. It will be a lot of fun for everyone to attend. Please don't forget to use my code, that is Chesta10, CHESTA10. Now, when you use this code, you can get yourself enrolled. In this test, different batches will get different question paper. The toppers or the rankers will have amazing prizes worth rupees 10 crores. Plus, you will also get the scholarship of Unacademy up to 100%. So please remember, on October 16th, 12 p.m., 60-minute test including 50 questions. Don't forget to use my code Chesta10. Thank you all of you. Good day and take care.